University in Belgium.
Thank you, Chairman, for the introduction. Good afternoon, everyone. Today I will talk about multiresistant Gallibacterium anatis in a clinical outbreak of infectious bronchopneumonia in beef cattle. So first of all, we already all know that infectious bronchopneumonia has a major economical impact in cattle production systems all over the world, with increased morbidity and mortality rates. And bacterial pathogens that are involved with this disease are Pasteurella multocida, Histophilus somni, Mannheimia hemolytica, and Mycoplasma bovis. But additionally, it's also the leading cause of antimicrobial use in these calves. And this results in an increasing pressure on the intensive antimicrobial consumption on food-producing animals. So our government in Belgium, but in a lot of countries, has made it a top priority to not only reduce this antimicrobial use, but also to have a rational antimicrobial use. And like, for example, in Belgium, there has been made some formularies that if you have infectious bronchopneumonia and you want to treat the animal, first you have first choice products like penicillin or in our country, fluorophenical. But if you want to use certain classes of antimicrobials who are important for human medicine, then you have to have identification and a susceptibility test. Now, in Belgium, for this identification and susceptibility test, we also perform a non-endoscopic bronchoalveolar lavage. So first we disinfect the nostril, and then with the tube, as you see right above, we go through the nose, through the larynx, into the trachea, and then sample a certain part of the lungs to have a representative sample of pathogens, what's going on in the lung. But what about Gallibacterium anatis? So it's a bacterium that is not quite known in bovine veterinary medicine, but it's a member of the Pasteurella family. So, and it's also a quite young bacterium, so the taxonomy has changed in 2007, where it became now Gallibacterium anatis instead of Pasteurella anatis. But it's also quite commonly isolated from chickens, and also a broad spectrum of domestic and non-domestic birds. But in chickens, it's frequently found in the upper respiratory tract and also in the lower genital tract of healthy chickens. But it can cause also pathological lesions, where it's the main cause of salpingitis and peritonitis, which results in a lowered egg production and also an increased mortality. Very rarely, it's also been isolated in humans, especially in severely immunocompromised individuals, where it can cause sepsis and then death. But what about this bacterium in calves? So I had one time that they found Gallibacterium anatis into a joint of a cow, but they didn't find where it come from or what was the meaning about it. And I also found one paper who describes these isolates from bovine origin, but also where it come from and where it was isolated, they didn't know. So here we describe a case report of a clinical outbreak of infectious bronchopneumonia in beef calves associated with multiresistant Gallibacterium anatis strains. So we had, from a period of 2017 to 2018, 6 different beef herds that were all suffering from infectious bronchopneumonia. And in these 6 different herds, we had 9 calves, all aged from 22 days till 4 months. 5 of these calves were presented at 2 different farms. So in farm 1 we sampled 4 animals, in farm 2 we sampled 1 animal, and they were all suffering from an acute clinical outbreak of this disease. We also had 4 different calves from the 4 different herds who came to our clinic. So we didn't went to the farm, but they came to our clinic, which also had infectious bronchopneumonia, but for a longer time, and they didn't get better with antibiotics, so that's why they come to our clinic to sample the animals. So all 9 calves had fever, so more than 39.3 degrees. They had a cough, nasal discharge. On auscultation, they had increased respiratory sounds, and also on ultrasound, they had signs of pneumonia, so consolidation of more than 1 centimeter, and also a lot of them had comma tails. And as I already mentioned, so the 4 calves that came to our clinic were already treated with first or second line of antimicrobials, like penicillin, trimsulfate, tetracycline, and ampicillin, but they didn't improve. So that's why they came to the clinic. So of all these animals, we took a non-endoscopic bronchoalveolar lavage. We put the samples for identification on a Columbia blood agar for Pasteurellacea and on a PPLO broth for Mycoplasma bovis. All the pathogens were identified with Maldito-Vames, and also one herd where we had the clinical outbreak where we sampled the 4 calves. We also did a PCR. So on the 3 main causes viruses, so corona, parainfluenza, and BRSV, and then for the 4 bacterial pathogens normally involved in the disease. So what did we find? In all these 9 samples, we had an identification of Gallibacterium anatis with a reliable score of Maldito-Vames of more than 2. And 6 of these cultures were a pure culture. So that means that we only isolated this bacterium and no other bacteria. We also had 1 dominant culture where you could find Gallibacterium anatis, but also Tripperella pyogenes. And 2 of the samples were polybacterial cultures. So we also isolated Staphylococci or Streptococci and also Gallibacterium anatis. Of all the samples, we could not find Mycoplasma bovis. And on the 1 PCR we did, that was also positive for parainfluenza 3, coronavirus, and also on PCR Histophilus somni and Pasteurella multocida. So we also did susceptibility testing of 14 antimicrobials. So this diffusion or Kirby-Bauer technique was performed for ceftiofur. We also did MIC gradient strip test for amoxicillin clavulanic acid, doxycycline, and enofloxacin. And then for a whole lot of other antimicrobials, as you can see in the table, we did broad dilution, so the gold standard. For the susceptibility testing, we used clinical breakpoints according to CLSI for Pasteurella multocida of cattle, because of course there are no clinical breakpoints for Gallibacterium anatis in cattle. So these are the results. So you can see that of the 14 antimicrobials we tested, that there was a lot of resistance, and that all isolates were only susceptible for amoxicillin clavulanic acid and ceftiofur. So those were the only ones who would work all the time. Then for the other antimicrobials, you can see that with the blue arrows that they already have a lot of acquired resistance. So very high MIC values due to mutation or horizontal gene transfer. So, and we also noticed this when we treated these calves with amoxicillin clavulanic acid or ceftiofur, that they would get better. And if you use other antimicrobials, it wouldn't work at all. So just a quick comparison with isolates from chicken. So in chicken, it's already known that this bacterium has a lot of resistance, that it's a multi-resistant strain. So this is a comparison of the MIC values and the resistance in chickens. And where there are blue circles, here we can see that there's a difference between the chickens and the calves that we had, and that in our calves there was even more resistance than in the chicken. So in the chicken, 65% of the isolates are multi-drug resistant, with a decreased susceptibility against 4 to 9 antimicrobials, and they were especially resistant against sulfa, tetracycline, tillozin, lincosamide, and penicillin. But if we then look at the isolates we retrieved from our calves, we could see that 100% was multi-drug resistant. So resistance against a minimum of 6 antimicrobial classes, and that they were only susceptible for amoxicillin clavulanic acid and ceftiofur. So to conclude, Gallibacterium anatis could play a role in infectious bronchopneumonia in calves, and also because multi-resistant is frequent, it can potentially cause therapy failure. But still, we have to bear some things in mind. So as I already mentioned, Gallibacterium anatis has already very rarely been described in cattle, but this was the first time that it was really associated with a clinical outbreak. Also, with the PCR we performed, we saw that there were 2 viruses, so parainfluenza 3 and coronavirus, that they were positive for those 2 viruses. So it could be that Gallibacterium anatis is a secondary pathogen which can cause pneumonia due to these viruses or due other factors that maybe can help this bacterium to cause pneumonia. And also the last thing, so there are no clinical breakpoints for this bacterium, so the interpretation for susceptibility testing always needs to be done very carefully. So I would like to thank everybody of my department who helped me with this case report, and also Buiatrics for getting me to Japan. And thank you, and if there were any questions, I will be happy to answer.